you. I'm the acting director of the European Union Center here at U of I. My name is Jessica Greenberg. I'm a sociocultural, political, and legal anthropologist. And as many of you know, I assume since you're here, the European Union Center is one of our area studies centers on campus. It's a Title VI resource center, as well as the Jean Monnet Center of Excellence, which means we get funding both from the Department of Education and also from the EU. And we think of ourselves as sort of a hub for information gathering, research, analysis, teaching, conversation, good energy on all things related to the European Union and European studies more generally here on campus as one of several area studies institutes as part of the Illinois Global Institute community. So welcome. And we're really, really thrilled to be celebrating and drawing attention to World Roma Day/week with this lecture. I am going to actually hand over to Tuba Aiken to do the introduction for our speaker today. Tuba is a graduate student in sociocultural anthropology here on campus. Some of you may know her, and is working in the areas of Roma studies, Romani studies, and thinking about social movements and politics and intergenerational organizing, intersection of politics and humanitarianism, just to name a few themes. Doing very exciting work as well. So I'm going to mute myself and hand over to Tuba for the introductions.
Good afternoon, everyone. Thank you for joining us today for this special International Roma Day Brownback event. It's an incredible honor to introduce Dr. Margareta Magda Matache, a powerful justice scholar, activist whose work challenges dominant narratives and uplifts Romani voices across the globe. Dr. Matache is a lecturer on social and behavioral sciences at the Harvard T.H. Chan School of Public Health and the director and co-founder of the Roma Program at the FXB Center for Health and Human Rights at Harvard University. Her research examines discrimination, reparations, social determinants of health, including educational, social, and economic disparities and their nexus with the historical past and contemporary public policies, with a particular focus on anti-Roma racism. From 2005 to 2012, Dr. Matache served as an executive director of Inequities, a Roma rights organization based in Romania. In 2012, she was awarded a Heuser postdoctoral fellowship at the FXB Center, where she founded Harvard's first and only Roma program. She is the co-editor of several key volumes, including Realizing Roma Rights, co-edited with Jacqueline Baba and Andrzej Mirga, which investigates anti-Roma racism in Europe, and Time for Reparations, co-edited with Jacqueline Baba, Caroline Elkins, and Walter Jansen, which explores the issue of reparations across a broad range of historical, geographic, and disciplinary contexts. Dr. Matache also serves on the O'Neill Lancet Commission on Racism, Structural Discrimination, and Global Health, contributing to international efforts to understand and address the health consequences of racism and discrimination. Her academic journey includes a PhD in political science, MA in European social policies, and a BA in social work from the University of Bucharest, as well as Master in Public Administration from the Harvard Kennedy School. Dr. Magda Matache is a leading transatlantic scholar in Roma rights activism, whose tireless commitment has transformed both academic and advocacy landscapes. Through her groundbreaking scholarship and global policy work, she has been pivotal in framing anti-Roma racism as a matter of structural injustice and public health, while critically challenging systems of racial exclusion and advancing a decolonial agenda centered on Roma features. Please join me in warmly welcoming Dr. Magda Matache.
Hello, everyone, and thank you so much, Tuba and Professor Greenberg, for the invitation. It's really an honor to be here with all of you today. As Professor Greenberg has already mentioned, We are here today to mark and observe and honor International Roma Day. So happy belated International Roma Day, everyone. Baktalo Romano Dive Romalen. In today's presentation, I will explore links between structural racism and health inequities, focusing specifically on the experiences of Roma people in Central and Eastern Europe. I will discuss a few specific health indicators and manifestations of anti-Roma racism. I will begin with some background information about the Roma people to help frame the discussion and a few concepts, terms, and definitions that will guide our conversation. A number of the concepts and arguments presented in this talk are also featured in my upcoming book, The Permanence of Anti-Roma Racism, Unauthored Sentences, which Routledge will publish this year. Now, first, when we speak about the Roma or the Romani people, or what you know derogatively as gypsies, we are actually referring to a global diaspora of more than 15 million people. You may know that Roma fled India or northern India approximately 1,000 years ago, and many moved across Western Asia into Southern and Eastern Europe. But intra and intercontinental peripateticness and migration, pushed and pulled by a diversity of factors, have played a significant role in shaping the European and global geography of the Romani groups, our diverse stories of cultural formation, traditions, dialects, religion, and identity. Today, the Roma people are dispersed globally. The majority, perhaps around 10 to 12 million people, are citizens or at least reside in European countries. Over 1 million live in North America, Canada, and the US, and over 1.5 million in Latin America. But the remaining Roma or Romani populations and groups are to be found particularly in the Middle East, Australia, or Central Asia. We can observe as much diversity within Romani groups and subgroups as in any other group or subgroup population, and I want to keep that in mind. But I also want to clarify that the structural inequities that I will discuss in this lecture primarily apply to socially and economically excluded Roma communities in Central and Eastern Europe. In this region, I will say most Roma individuals hold legal citizenship, but often lack political, social, symbolic, and cultural recognition. So symbolic citizenship and political citizenship. And this situation has significantly limited many of us, Roma, in terms of feeling a genuine sense of belonging in the countries where we are citizens, in the countries where we were born. So we are constantly constrained between edges of belonging, neither granted complete citizenship within the nation states of our birth and citizenship, nor necessarily preoccupied with immersing ourselves in the imagination of a diasporic global Romani community. Throughout history, Romani people have experienced enduring distinct and intertwined collective and individual injustices in all spheres of life, politics, and society. And Romani individuals, families, groups, and scholars have named, felt, and lived these experiences in personal but also multifaceted ways. So, for instance, several contemporary theories addressing this form of oppression, I'm talking about Romaphobia, discrimination, anti-Gypsyism, anti-Roma racism, have been proposed, accepted, debated, challenged, and rejected within many academic and political circles. But generally, I would say that scholars of Romani studies and critical Romani studies, a more critical chapter of this field of study, use the concept of anti-Gypsyism to name this racism and suggest that the roots of anti-Romani oppression are to be found in historically constructed hatred and prejudice, which a contemporary focus on, which puts this contemporary focus on people and groups that are stigmatized as gypsies in the public imagination. So that's the rationale for this framework of anti-Gypsyism. That's when examining the oppression experienced by Romani people, this theoretical model and its transmission into policies and practices often highlight and focus on ideology and prejudices as the primary sources of oppression. In turn, to frame this long durée of anti-Roma oppression, I draw on a few radical theoretical traditions that connect racism both to the very core of Western liberalism and the historical legacies and continuities of a social system meant to advance white Europeans' agendas and interests. As I operate with the term anti-Roma racism when I refer to the experiences of Roma people in Central and Eastern Europe. If I refer to the oppression of all Romani groups in Europe and their diversity, then I use either the term anti-Romani racism, or I talk very specifically about anti-Roma and anti-Sinti racism in Germany, or anti-Roma and anti-Gypsy and anti-traveler racism in the UK, just to give you a few examples. But in fact, globally, the scholarship defines and understands racism or racisms in different ways, often from the lenses of our own field of study, school of thought, lived experiences, and more so somewhere on the spectrum between the liberal theory of racism and the structural structural theory of racism. And what do I mean by these theories? And I would say that the liberal theory of racism has its roots in a book called Racismus, which Magnus Hirschfeld published in the 1930s. And this book unpacked and theorized the connections between the 19th century theories of racism and the rise of Nazism and fascism in Europe. This theory suggests that racism arises from ideologies and individual beliefs within institutions and societies, but they influence our liberal societies as a whole. So liberalism in itself is not racism, but these ideologies impact and influence liberal societies. It also suggests that we can address racism through rationality and education. We can employ DEI workshops, myth bursting, and so on. So this, in this context and in this framework, racists and anti-racists are viewed as opposing forces engaged in a struggle over conflicting beliefs. This theory, to a large extent, missed acknowledging the brutality of colonialism, the brutality of anti-Roma oppression, but also intracontinental settler colonialism, all which happened before Nazism. That's in response in the 1930s and after, authors like Anton de Kom, C.L.R. James, Aimé Césaire, and Frantz Fanon put forward a more radical understanding of racism, which Arun Kundnani calls now the structural theory of racism. And these intellectuals, but also revolutionaries from the Caribbean, argued that racism functions as a structural social system that facilitates economic exploitation and power. So somehow closer to a Marxist approach, if you want, that links production and exploitation. And this approach highlights a tie between economic interests, cultural attitudes, but also political organization, emphasizing that it is the system rather than ideologies and individual beliefs that create, foster, and perpetuate racism. And this structuralist framing means recognizing the historical roots, enduring legacies, and continuities of injustices and oppression. But it also entails emphasizing the interactions and ties across all levels and manifestations of racism, but also between various systems of oppression, being them related to race, gender, ableism, and class, and so much more. But perhaps this is not the topic of my my lecture, but I wanted to give you a framework and to conclude this slide to say that both theories examine racism, but they have a different focus. One focuses on ideologies, individual beliefs, and education as a response, and the other focuses more on structural and economic factors and the role of power in actually creating hierarchies and oppression. But now, in the case of the Roma people, there is evidence of anti-Roma prejudice, behaviors, and measures ever since arrival in Europe. For example, after Romani communities settled in different regions of Europe, such as the Basque country, present-day northern Spain, residents refused to allow Roma in their churches. Roma could only participate in service by looking in from the window of a church. Or in the 1560, a decree from the Archbishop Petri of Sweden stated that the priest should not concern himself with the Roma. He shall neither bury their corpse nor Christian their children. Yet, shortly following the migration of the Roma people from India into European territories, European Gage, when I use the word Gage, I mean non-Roma, this is a word in Romani language. The Europeans, particularly institutions, began to cast Roma families and groups in and as an absolute periphery. So the margins of society, of territories, of life and culture. So essentially this peaceful arrival of the Romani people was not met with a warm reception. So harmful narratives, attitudes, and actions were coupled with anti-Roma policies and measures. So essentially, we are talking about coalescing processes of racism and racialization at the institutional level. So it is true that oppression and violence were normalized and naturalized through racist theories and research and myths and prejudices, but ideology, I argue, was not the cause of racism, of anti-Roma racism. Power, resources, lands, and prejudice were. Nevertheless, I think it's important to recognize that these processes of racialization existed, and I call them processes of racialization because I believe that racialization as a process is much more than just prejudice or stereotypes, because we all have stereotypes about various populations, but it doesn't mean that that stereotypes impact everyone in the same way. So in the processes of racialization, we see a dynamic of caste hierarchy, if you want. You have human hierarchies. So my argument here is that processes of racialization of the Roma people, not only prejudice, have been shaped by various contexts while remaining a persistent issue for centuries across different regions. the origins of this long-standing phenomenon can be linked to several historical, political, social, and intellectual moments. I'm talking about the system of racialized slavery in the historical Romanian principalities, and I'll focus a little bit more on this moment in my presentation. I'm talking about violent expulsions, Roma hunts, killings during the Middle Ages and early modern period, but also the rise of race science, the eugenics movement, Nazism, and then racialized communism, and of course, what is happening today. So essentially, these factors and knowledge and power contributed to the systematic construction of the Roma as a distinct, criminalized, and fundamentally inferior other, painting us as a singular race outside the bonds of society. But early on in the Middle Ages and early modern period, upon arrival of the Roma, Eastern European sovereigns, particularly in the Eastern and Central Europe, adopted violent measures against our ancestors. And I think that we can talk about two prevailing approaches towards the Roma people. One is asserting ownership over the Roma people, and the other one is establishing this exclusive Gajikano or white control and residence in their lands. So essentially, we are talking about two parallel, but at the same time, relational forms of institutionalized oppression, a system of racialized slavery and a system of spatial monopoly and purity that was implemented through expulsions and entry bans. Thus, I situate the origins of anti-Roma racism within these political and collective projects and interests. So the genesis of anti-Roma racism are to be found in these structures and systems across Europe and in this effort to uphold the organization of power, land, wealth, and prestige. So I argued that to discuss anti-Roma racism, it is critical to start with medieval times. The Roma enslavement, expulsions, evictions, or gypsy hunts targeted people of common descent, a policy often legitimized and normalized through biocentric and theocentric depictions and the construction of harmful myths about collective and inherent behaviors, thus through racialization. And when it comes to these forms of racialization, we can see various patterns. One is the racialization of the body. We see these biological, but also theological centric characterizations of Roma people and the addition of various harmful attributes. On the other hand, we see the construction of various myths, harmful myths, the construction of the criminal Roma, the construction of the lazy Roma, the construction of a particular way of life. And then we see racialization as a relational process. Very often in the history of the Roma people in Europe, we see a very clear relationship in the processes of racialization of Roma people and Black people, particularly Africans, or Roma people and Jewish people, particularly Europeans. And that really resonates so much in the 1800s that even the Roma people themselves, when they talk about enslavement, they refer to themselves in relation to the oppression of the Jewish people. So my argument is that processes of racialization, as much as systems of oppression, are not isolated. They are always connected with other systems of oppression in place. So essentially, I define and conceptualize anti-Roma racism as a structural form of oppression. So I follow the path of the structuralists in that in this approach. So I'm thinking about anti-Roma racism as a organized, enduring, and self-preserving non-Roma technology and order. And I argue that this form of racism has been continuous and has targeted Roma people for more than 700 years. So basically since our arrival on the continent. And although it has been persistent, it has transformed. So not every political regime and not every geography maintain the same level or the same methods of racism. But I would say that regardless of the methods and the visibility of this form of racism, it has impacted and marked the lives of Roma people in many visible and invisible ways. So anti-Roma racism, as much as any structural racism, continues to reproduce itself in liberal and progressive spaces. Thus, in the absence of overt racist ideologies or overt biases or prejudices and stereotypes. So by taking this structuralist approach, I depart from these existing articulations of the oppression faced by the Roma people, and more so, I take distance from the liberal theory of racism, because the structural dimensions of anti-Roma racism point not only to obvious forms such as school segregation or police killings, although they happen on regular basis, but they also, this form of racism also manifests itself through covert manifestations. I'm talking about race-silent policies, erasure of our history and culture, systemic disinvestment in Roma neighborhoods, lack of power and power resources, and so much more. Thus, racism to me is not discrimination, but rather discrimination is a manifestation of racism. Anti-Roma racism does not involve only prejudice or discriminatory actions, but more so it involves social, cultural, and institutional power for the dominant groups and structural inequities for the subaltern, in this case, the Roma people. And finally, very important for our conversation today, structural inequities, including inequities in health, are consequences of many factors and contexts and environments, but also many forces, but more so they are consequences of structural racism, which is very distinct due to its continuum. So it basically started years ago. But now everything has been a little bit too abstract. Perhaps I should just use an example to go through all these elements of what anti-Roma racism means to me and how it manifests in health. So I'm going to use the example from a recent incident in Romania. In July of 2023, a 24-year-old Roma woman from Urziceni, a small city in Romania, delivered her baby on the sidewalk outside the municipal hospital in Urziceni. She had been in labor for about 15 minutes upon arrival at this hospital. But as per the woman's account, upon reaching the emergency room, there was no doctor or nurse available for check-in. When she began expressing distress through screams of pain, a nurse eventually appeared and questioned why she was screaming, cautioning her that it might disturb the healthcare staff who were sleeping. The nurse dialed 911. In Romania, it was 112 to arrange transportation for the pregnant woman to another hospital that had a gynecologist in the emergency room. But nevertheless, as reported by the patient, the nurse did not assess her condition at all. Didn't even look at her, didn't touch her, and instead instructed the woman to proceed to the hospital's entrance and wait for the ambulance. This was a national scandal, but in response, the president of the College of Doctors the body in Romania that looks at ethics in medical care confirmed that according to the procedures, the patient was supposed to undergo examination, but the hospital records indicated no evidence of such an examination taking place at all. But more so in response to the incident, the mayor of the city condemned it. But he also emphasized that this Roma woman was, and you can see the words on the screen, but also she lacked education. So this is an outrageous case. It doesn't happen every day, but there are several elements related to it that I want to mention. So one question is whether this case is unique. And the short answer is no. There are many NGOs and researchers that have documented overt discriminatory practices in medical and hospital care and services. In 2014, Roma Inequities, a Roma rights NGO that I used to lead until 2012, documented the practice of segregating Roma patients in some Romanian hospitals. The hospitals also kept Roma women in wards that were untidy, unrenovated, and nurses would rarely change linens and give babies medicine using unsterilized utensils already used on other patients. Additionally, a 2017 survey showed that 68% of the Romanian Roma responding in that survey experienced negative attitudes from healthcare providers, so 68%. Another 2023 study shows that 16% of the interviewed Romanian Roma in a study felt discriminated against when they were accessing health services. And lastly, in 2019, some of you may recall this article, the New York Times reported on the separation of a 4-month-old Romanian Roma baby from his parents in the United States. But alongside this awful experience, the article also mentioned the experience of the mother of this child in Romania, who apparently went through forced sterilization. Now, Romania is it's a case where we find examples of forced sterilization here and there, but I want to emphasize that in the Czech Republic and Slovakia, forced sterilization was a practice in many hospitals across the countries until the 2000s. So basically, when these two countries were part of the European Union already. But now another question that we could unpack is if beyond such overt manifestations of discrimination, we can observe indicators of health inequities and more subtle outcomes of racism. And this time around, the answer is again, yes. So the Roma population represents the largest ethnic minority, ethnic group in Romania, with an estimated population of about 2 million people, which is roughly 10% of the Romanian population. But health violence really transpires across many measurable indicators, with Roma communities and individuals faring far worse in recorded major health outcomes and access to health services than the majority populations. Essentially, the Roma people live sicker and shorter lives. And it is the case of other racialized and oppressed groups across the world. We know this from research, including in the US. But some of the most striking signals of health violence and racialized distribution of health are low life expectancy and high premature mortality rates. Roma people live about 7 years less on average than the majority population, and Roma infant mortality is 4 times the national average. And furthermore, in the past few years, particularly during the COVID-19 pandemic, we could see that the health disparities, but also the economic inequities deepened, and stigmatization and violence exacerbated, with Roma being increasingly targeted as contaminators and threats to public health. And again, here, if you're to look at parallels with other racialized populations, we can see that in the case of Native Americans, Chinese Americans, Black Americans, South Africans, Jewish people, and so much more. So this idea of contamination tied to a racialized population is an old encounter. And at the same time, there are many expressions of everyday racism or everyday discrimination, or what Professor Michel Lamont called an assault on worth. And we can observe these patterns also in many hospitals, but also in the ways in which the nurse treated that Romanian woman in the hospital. She didn't even look at her or wanted to talk to her. So being ignored or overlooked, misunderstood, or fear are measures that Lamont and others frame under the umbrella of stigmatization or assault on worth. And now let me also explore poverty as a documented social determinant of health, but also to underline that the woman in the case presented was definitely a poor woman. The mayor called her uneducated, but I think, the poverty element was there somehow implied. You may know that the GDP of the European Union is the second largest in the world, or this is what we've had in the past few years. Yet on average, 80% of the Roma people in the European Union, including Romania, live below the at risk of poverty threshold, compared to only 17% of the European populations. And as you can see, sometimes poverty is really beyond imaginable. More than half of the Romanian Roma, for instance, live in poorly resourced and residentially segregated neighborhoods, some living in poor houses or slums. And I want to emphasize that there is quite a bit of research across the world. For instance, public health expert David Williams, but also others, have shown that although social and economic status is an important causal pathway that links race and ethnicity to health, racism also constitutes a risk factor and a determinant of health. In fact, the social and economic determinants of health have long been filtered, if you want, through and multiplied by and during anti-Roma racism. Furthermore, more than half of Romanian Roma population lack access to a medical or facility or a pharmacy. So the lack of medication, healthcare resources, and facilities feeds and drives health inequities and negative health outcomes, including premature death. Such disparities, I would say, affect primarily poor and residentially segregated Roma neighborhoods. Often, explanations for such health and economic inequities have been framed through this victim-blaming approach, focusing on the Roma culture, on the so-called Roma behaviors, as if behavior was inherited, or simply identifying poverty as a source of poor health. But essentially, the policies, technologies, and practices employed by the state in such politics of let die, if you want, alluding to Foucault and Mbembe's work, are rationalized and legitimized through scientific racializing narratives, Roma people's lifestyle, behavior, and racial genetic differences. So not only power and institutions and hospitals deem Roma lives as ungrievable, using Judith Butler's concept, but also science continues to contribute to this pattern of basically framing health inequities through the lenses of Roma culture, Roma behaviors, and some sort of racial genetic differences.